How to chairside pick up a locator denture by the restorative doctor. Verify the centric occlusion and the VDO. Prior to the final appointment, take time to familiarize yourself with all the parts and components provided by Allure Dental Studio. For demonstration purposes, we are using a model in place of the patient's mouth. The spacer is used to block out the area immediately surrounding the abutment. The space created will allow the full function of the pivoting metal denture cap over the locator black processing replacement male. If the white blockout spacer does not completely fill the space between the tissue and the metal denture cap, it is necessary to block out any remaining undercuts. This prevents excess acrylic from locking the denture onto the abutment. This can be accomplished by stacking more blockout spacers. If you don't have extra spacers, cut a small piece of rubber dam and place them first, then add the spacer on top. Insert a locator denture cap onto each locator implant abutment, leaving the spacers beneath. The black processing replacement male will help prevent the overdenture from rebounding during the processing procedure. Prepare a recess in the denture for the locator cap. Make sure that the holes in the denture are large enough to accommodate the abutment and the caps. Check for smaller holes across the top of the denture. This will help with any excess acrylic. There can be no contact between the denture and the titanium cap. If the denture rests on the cap, it may place excessive pressure on the implant. An autopolymerizing or light cured acrylic resin may be used to pick up the caps. Apply bonder to the denture area. Follow with acrylic. Apply a small amount of acrylic around the edge of each cap. Seat it over the caps and onto the tissue. Apply extra acrylic in any visible voids. Guide the patient into occlusion and have the patient close. You must hold the patient's jaw in place with the help of the bite, which was made at the beginning of the appointment. Remember, low pressure, but do hold it in proper centric, and let the acrylic set as per the manufacturer's recommendation. The locator male seating tool is used to firmly push a locator replacement male into the metal denture cap. Use the locator male removal tool to remove the black processing replacement male from the metal denture cap. Discard the white blockout spacers. The sharp circular edge of the end of the removal tool should be wedged tightly down into the very bottom of the male, so that it will catch the inside. To discard the male from the tip of the core tool, point the tool down and away from you, then tighten the male removal tool clockwise back onto the core tool. This will activate the removal pin and dislodge the male from the tip of the male removal tool. The replacement male must seat securely into place, level with the rim of the cap. Equilibrate the occlusion.